These notes were turned to speech using text-to-speech software. Students with communication disorders. Communication entails receiving, understanding, and expressing information, feelings, and ideas. The American Speech-Language Hearing Association 1993 defines a communication disorder as an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal and graphic symbol systems. A communication disorder may be evident in the processes of hearing, language, and/or speech. A speech disorder refers to difficulty producing sounds as well as disorders of voice quality, for example, a hoarse voice, or fluency of speech, often referred to as stuttering. A language disorder entails difficulty receiving, understanding, or formulating ideas and information. A receptive language disorder is characterized by difficulty receiving or understanding information. An expressive language disorder is characterized by difficulty formulating ideas and information. Speech is the oral expression of language, which occurs when a person produces sounds and syllables. As a person pushes air from the lungs, the muscles in the larynx move the vocal folds, producing sounds. The larynx sits on top of the trachea and contains the vocal folds, ligaments of the larynx. Voice is produced here. A person forms sounds by varying the position of the lips, tongue, and lower jaw, as the air passes through the larynx, pharynx, mouth, and nose. Language is a structured, shared, rule-governed, symbolic system for communicating. The 5 components of our language system are phonology, sound system, morphology, word forms, syntax, word order and sentence structure, semantics, word and sentence meanings, and pragmatics, social use of language. Phonology is the use of sounds to make meaningful syllables and words. Phonology encompasses the rules in sequencing of individual speech sounds, called phonemes. Morphology is the system that governs the structure of words. Owens, 2012. The smallest meaningful unit of speech is called a morpheme. For instance, when S is added to Bill, the word becomes plural. Formerly having had one morpheme, the word now has 2, Bill, a mouth structure on a bird, a written document, and S, denoting plurality. Morphological rules allow speakers to add plurals, inflection, affixes, and past tense markers to verbs. For example, correct use of morphological rules allows a child to change swim to swimmed and then, as the child matures, to swam, an irregular past tense verb. Syntax provides rules for putting together a series of words to form sentences. Phonology provides the rules for putting together strings of phonemes to form words. Syntax provides rules for putting together a series of words to construct sentences. The first 3 dimensions of language, phonology, morphology, and syntax, combine to determine the form of language, that is, what the language looks like. The next 2 dimensions of language, semantics and pragmatics, determine the content and social use of language. Semantics refers to the meaning of what is expressed. Semantic development has both receptive and expressive components. Children first learn to understand the meaning of words and then to verbally or manually use the words and sentences meaningfully. Children start out with a small number of words that represent a large number of objects in their environments. For example, to young children, all men may be daddy. This is called an overextension and is typical in semantic development. Pragmatics refers to the use of communication in contexts. Pragmatics is the overall organizer for language. Owens, 2012. Caregivers and infants use the rules of pragmatics in their interactions, and children learn to use social communication very early. Social interaction theories emphasize that communication skills are learned through social interactions. Hoff, 2009. Parents and caregivers teach language during their interactions. Speech disorders include disorders of articulation, voice, and fluency, the rate and rhythm of speech. These disorders can occur alone, in combination, or in conjunction with other disorders. Articulation disorders. Articulation disorders are among the most frequent communication disorders in preschool and school-aged children. Articulation is a speaker's production of individual or sequence sounds. An articulation disorder occurs when the child cannot correctly produce the various sounds and sound combinations of speech. Articulation errors may be in the form of substitutions, omissions, additions, and distortions. Substitutions are common, as when the child substitutes D for the voiced TH, those for those, or W for R, wabbit for rabbit. Omissions occur when the child leaves a phoneme out of a word. Children often omit sounds from consonant pairs, boo for blue, and from the ends of words, ape for apple. Additions occur when students place a vowel between two consonants, converting tree into tarry. Distortions are modifications of the production of a phoneme in a word. A listener gets the sense that the sound is being produced, but it seems distorted. Common distortions, called lisps, occur when S, Z, SH, and CH are mispronounced. When children have serious articulation disorders, they usually benefit from evaluation for an alternative augmentative communication device. Apraxia of speech. Apraxia is a motor speech disorder that affects the way in which a student plans to produce speech. Apraxia can be acquired as the result of a trauma such as a stroke, a tumor, or a head injury, or with other disorders. Students with apraxia have difficulty with the voluntary, purposeful movements of speech even though they have no paralysis or weakness of the muscles involved in speech. Voice disorders. Each person has a unique voice. This voice reflects the interactive relationship of pitch, duration, intensity, resonance, and vocal quality. Pitch is determined by the rate of vibration of the vocal folds. Men tend to have lower-pitched voices than women do. Pitch is affected by the tension and size of the vocal folds, the health of the larynx, and the location of the larynx. Duration is the length of time any speech sound requires. Intensity, the loudness or softness, is based on the perception of the listener and is determined by the air pressure coming from the lungs through the vocal folds. Resonance is the perceived quality of someone's voice. It is determined by the way in which the tone coming from the vocal folds is modified by the spaces of the throat, mouth, and nose. Hypernasality is when air is allowed to pass through the nasal cavity on sounds other than M, N, and NG. They may sound as if they have a cold or are holding their noses when speaking. This is referred to as hyponasality because air cannot pass through the nose and comes through the mouth instead. Fluency disorders. Normal speech requires correct articulation, vocal quality, and fluency, the rate and rhythm of speaking. Fluent speech is smooth, flows well, and appears to be effortless. Fluency problems are characterized by interruptions in the flow of speaking, such as atypical rate or rhythm, as well as repetitions of sounds, syllables, words, and phrases. Students may have language disorders that are receptive, expressive, or both. Their language impairment may be associated with another disability, or it may be a specific language impairment not related to any physical or intellectual disability. Phonology. Students with phonological disorders may be unable to discriminate between differences in speech sounds or segments that signify differences in words. For example, the word pen may sound no different from pin. Their inability to differentiate sounds, as well as similar, rhyming syllables, may cause reading and/or spelling difficulties. Morphology. Children with morphological difficulties have problems using the structure of words to get or give information. They may make a variety of errors. For example, they may not use it to signal past tense, as in walked, or as to signal plurality. When a child is unable to use morphological rules appropriately, the average length of her utterances is sometimes shorter than expected for the child's age because plurals, verb markers, and affixes may be missing from her statements. Syntax. Syntactical errors are those involving word order, such as ordering words in a manner that does not convey meaning to the listeners. Example, where one them park at. Using immature structures for a given age or developmental level. Example, a 4-year-old child using two-word utterances, such as him sick. Misusing negatives. Example, a 4-year-old child saying, him no go. Or omitting structures. Example, he go now. Semantics. Children who experience difficulty using words singly or together in sentences may have semantic disorders. They may have difficulty with multiple meaning words and have restricted meanings for words. McCormick and Loeb, 2003. Some students with semantic disorders may have problems with words that express time and space. Example, night, tiny. Cause and effect. Example, push button, ball goes. And inclusion versus exclusion. Example, all, none. Pragmatics. Pragmatics focuses on the social use of language, which is the communication between a speaker and a listener within a shared social environment. Pragmatic skills include adapting communication to varied situations, obtaining and maintaining eye contact, using appropriate body language, maintaining a topic, and taking turns in conversations. Pragmatic disorders are reflected in many different ways. A student who talks for long periods of time and does not allow anyone else an opportunity to converse may be displaying signs of a pragmatic disorder. There are 2 types of speech and language disorders, each classified according to its cause. 1. Organic disorders. Those caused by an identifiable problem in the neuromuscular mechanism of the person. And 2. Functional disorders. Those with no identifiable organic or neurological cause. The causes of organic disorders are numerous. They may originate in the nervous system, the muscular system, the chromosomes, or the formation of the speech mechanism. They may include hereditary malformations, prenatal injuries, toxic disturbances, tumors, traumas, seizures, infectious diseases, muscular diseases, and vascular impairments. A functional speech and or language disorder is present when the cause of the impairment is unknown. An articulation disorder with no known physical cause is regarded as functional in nature. Communication disorders can be classified further according to when the problem began. A disorder that occurs at or before birth is referred to as a congenital disorder. A disorder that occurs well after birth is an acquired disorder. Speech assessments determine the presence of articulation, voice, or fluency problems. Articulation assessments evaluate a student's abilities to produce speech sounds in single words, sentences, and conversation. An oral motor exam, which is the examination of the appearance, strength, and range of motion of the lips, tongue, palate, teeth, and jaw, is also typically conducted. Voice evaluations include information about the onset and course of the voice problem, environmental factors that might affect vocal quality, and typical voice use, Verdolini, 2000, including pitch, intensity, and nasality. When completing a fluency assessment, the speech-language pathologist measures the amount of disfluency as well as the type and duration of disfluencies while the student is speaking. Language assessments focus on specific components of language such as phonology, semantics, morphology, syntax, pragmatics, and overall expressive and/or receptive language. Speech and language pathologist observing the child in different environments and with various communication partners. Downing, 2005. For example, the speech and language pathologist might observe this interaction. John looks at a friend's snack and then at his friend. He repeats this behavior several times. When the friend gives John some of his snack, John smiles. The speech and language pathologist then notes the communication functions observed and the form the student used, including that John initiated a communication interaction, requested an item, and expressed a social interaction, example, thank you or please. John's forms of communication included eye contact, to gain attention to initiate communication, eye gaze, to request, and facial expression, a smile as thanks. The speech and language pathologist then determines how to shape and expand on John's communication forms, example, speech, pointing to pictures, voice output, etc. Curriculum-based assessments use tasks and materials that relate to the general education curriculum and depend on partnerships to be accomplished. Nelson, 2010. Whether the student is asked to discuss a topic verbally, answer questions, read language, write language, or work with others cooperatively, he is practicing language throughout the entire curriculum. The speech-language pathologist may need other members of the team to assist in data collection. The classroom teacher often collects data because the teacher is generally with the student for more of the day than other educational staff are. The speech-language pathologist then analyzes the data and makes decisions about instruction based on them. Howard and Nolet, 2000. This procedure is called data-based performance modification. Howard and Nolet, 2000. Assisted assessment is the process of determining what strategy or supports the student may need to accomplish the task that is being monitored. Communication occurs throughout the day, so it is important for everyone who works with the student to have a good understanding of how she best understands and/or expresses information. For instance, the lunchroom and recess staff may need to understand strategies to help her initiate requests from others, take turns, and use augmentative alternative communication systems. Direct service involves direct contact between the student and the speech-language pathologist. Historically, direct services have constituted the majority of a speech-language pathologist's workload. By contrast, indirect services consist, for example, of designing and programming a student's augmentative communication device and training paraeducators in how to use it. Indirect activities also include meeting and planning with teachers and paraprofessionals to align the student's IEP goals with the standards for the general curriculum and designing instructional strategies so the student can make progress in the general curriculum. One form of assistive technology is an augmentative and alternative communication system. Augmentative alternative communication systems consist of integrated components that supplement the communication abilities of individuals who cannot meet their communication needs through speaking. An augmentative alternative communication system may include an augmentative alternative communication device, a physical object to transmit or receive messages, and other types of communication such as gesturing, speaking, and/or writing. Augmentative alternative communication devices include communication books, communication/language boards, communication charts, mechanical or electronic voice output equipment, and computers. An augmentative alternative communication device contains a set of symbols. A symbol is a visual, auditory, gestural, and/or tactile representation of a concept. Symbol sets include photographs, pictographs, symbols that look like what they represent, ideographs, more abstract symbols, printed words, objects, partial objects, miniature objects, braille, textures, or any combination of these symbols. When you use only one or two methods to teach, especially if you only use verbal methods, some students with communication disorders, as well as some students without disabilities, are not able to access the material. To assist, you can vary the format for relaying the information, such as by using both audio and text formats, visual representations with verbal information, graphics, graphic organizers, and controlled vocabulary. Similarly, you can vary the ways in which students demonstrate their knowledge. For instance, instead of assigning only a written report, also allow PowerPoint presentations, demonstrations with visual supports, taped oral reports, or dramatic performances. Graphic organizers are a form of advanced organizer. They assist students to comprehend and write more effectively. Graphic organizers provide a visual representation in an organized framework, and they are especially useful for students with Down syndrome, autism spectrum disorders, and language learning disabilities, as well as students who are learning English as a second language. Graphic organizers can be hand-drawn or computer-generated. Augmentative alternative communication instructional strategies should focus on teaching communication rather than solely teaching the student to operate augmentative alternative communication systems. One instructional strategy for modeling how to use augmentative alternative communication is the System for Augmenting Language, Romsky and Sevchik, 1988, focuses on augmented input of language. Using System for Augmenting Language, communication partners augment their speech by activating the student's communication device in naturally occurring communication interactions at home and school and in the community, encouraging but not requiring the student to use the device. For example, during a literacy discussion, you could introduce the task by saying, "We will read this story, then you will tell what happened first, second, third, and last in the story," while activating buttons on the device for a read story. Then, tell first, second, third, and last. The student is not only a model of what symbol vocabulary to use in that situation but also a model of how to use the vocabulary in conversation. Data-based performance modification procedure to monitor a student's progress and make decisions about instructional strategies. Here's how that measurement system works. With input from the educational team, the speech-language pathologist teams with the student's teachers to try to reduce the discrepancy between the student's current communication skill level and the curriculum standard against which the student's progress is assessed. For example, if a student exhibits atypical disfluencies, or stuttering, and if the disfluencies negatively affect her participation in class, interaction with other students, or both, the speech-language pathologist might set a goal of monitoring the amount of class participation that occurs as a result of the student's improved fluency. Give the teacher and the parents suggestions that may be helpful when speaking with someone who stutters. Work with the student to teach different fluency strategies. Observe in class to monitor the use of the strategies in the classroom and the student's class participation, and ask the teacher to rate the student's fluency during the day and tally class participation at agreed-upon times. When assessing a student with more significant speech and language impairments, you should ask, what is being assessed? How does the student best receive information, and how does the student best express himself? You should consider the focus of the assessment in order to reduce the chances that the student will be assessed in more than one area at one time. For instance, if the student's augmentative voice output communication system is new or unfamiliar and he uses it during a science test, you may not be accurately assessing the student's understanding of science but the student's knowledge of the communication system. Similarly, if a student who exhibits difficulty understanding written complex language structures takes a science test but the test format is not adapted for him, then you may be assessing the student's ability to read complex sentence structures as well as his knowledge about science. If you want to assess the student's understanding of complex language structures, then you should make sure that the test consists of complex structures. If, however, you are assessing science, you may need to take into account the student's preferred manner of receiving information. If a student has difficulty expressing herself in verbal or in written form, you should use an assessment format that does not require long verbal or written output. For example, a multiple choice or true-false format may be helpful. Summary: identifying students with communication disorders. Communication disorders include both speech and language impairments. A speech disorder is an impairment of one's articulation of speech sounds, fluency, or voice. A language disorder reflects problems in receiving information, understanding it, and formulating a spoken, written, or symbolic response. Communication differences that are related to the culture of the individual are not considered impairments. Language is a shared system of rules and symbols for the exchange of information. It includes rules of phonology, morphology, syntax, semantics, and pragmatics. Communication impairments can affect a student's academic, social, and emotional development. Evaluating students with communication disorders. The speech-language pathologist is the professional who determines the presence and extent of a speech and/or language impairment. Assessments include the use of informal and formal measures. They should occur in settings that are comfortable and natural for the student. Designing an appropriate IEP. The collaborative participation of students, their teachers, speech-language pathologists, and parents to enhance communicative development results in students' language objectives being targeted in many settings and situations. When planning universal design for learning for students with communication disorders, a teacher must answer two questions. How can I assure that my student understands what I am teaching? And how can I assure that my student can express what she knows? Using effective instructional strategies. Students with communication disorders benefit from language facilitation strategies in early childhood. Graphic organizers can be helpful for elementary and secondary students with communication disorders. Students transitioning to community-based instruction will need instruction and support to meaningfully integrate their alternative augmentative communication systems into this new environment. One instructional strategy that has been effective is the system for augmenting language. Assessing students' progress with communication disorders. Curriculum-based assessment can help monitor students' progress in the general education curriculum. Ecological inventories can be helpful for assessing and monitoring progress in and outside the classroom.